Hello, everyone. We will start shortly. Just want to pause a few seconds for everyone to join. Hello again. I am Joe Coletti with Urban Initiatives, and I want to welcome California Continuum of Care Collaborative Applicant Alliance leaders, other CLC leaders, and federal and state partners and representatives to our Advancing Federal, State, and Continuum of Care Collaboration to End Domestic Violence and Sexual Assault webinar. Our 5 webinar panelists are noted on our first slide. Many of you know William Snow, who is Senior Program Specialist with HUD's Office of Special Needs Assistance Programs, often referred to as SNAPS. Many of you know LaToya Young, who is Special Needs Assistance Program Specialist, also with HUD's SNAPS program. Please know that right after William and LaToya share about advancing federal and continuum of care collaboration to help end domestic violence and sexual assault, there will be an opportunity for 2 or 3 of you to verbally ask them one question each by raising your hand, and then you will be called upon and allowed to unmute yourself. Many of you know Dakshika Wikrema, who is Deputy Secretary of Homelessness at the California Business, Consumer Services, and Housing Agency, or often referred to as BCSH. Right after Dakshika shares about advancing state and continuum of care collaboration to help end domestic violence and sexual assault, there will be an opportunity for 2 of you to verbally ask her one question each by raising your hand, and you will be called upon and allowed to unmute yourself. Representatives from the California Partnership to End Domestic Violence and VALOR will share opportunities to advance collaboration with CLCs. As you can see on the slide, Jennifer Willover is the Housing Policy Analyst for the California Partnership to End Domestic Violence, California's recognized domestic violence coalition. She will share opportunities to advance collaboration between CLCs and the California Partnership to End Domestic Violence. Grace Glazer is the Public Affairs and Policy Manager for VALOR, California's recognized, as you can read there, recognized sexual assault coalition. She will share opportunities to advance collaboration between CLCs and VALOR. There'll be an opportunity for 2 of you to verbally ask Jennifer one question each after she has finished sharing by raising your hand, and there'll be an opportunity for 2 of you to verbally ask Grace one question each after she has finished sharing by raising your hand. If you have a question for any of our panelists and we did not have time for you to ask, please type your question in the Q&A window, and your question will be answered after the webinar and emailed to you and everyone else. Now, before we begin with William, please know that after all our panelists are finished sharing, there will be an opportunity for you to verbally share comments, observations, suggestions, or next steps regarding collaboration with everyone towards the end of our webinar. This will not be a time for you to verbally ask questions at the end of our webinar. The plan is to have as many of you as possible verbally share any comments, observations, suggestions, or next steps that you may have regarding collaboration with federal and state partners, including the California Partnership to End Domestic Violence and VALOR, before our planned time together ends. At that time, you will be asked to raise your hand and you will be allowed to unmute yourself and share. So with that, I want to go ahead and begin with William.
All right. Thanks, Joe. Always a pleasure. Thanks everyone for joining. This is an historic event in that it's been a long time since we've seen a space, perhaps not ever, where we have a convening like this to talk about the important convergence of homelessness and how the homeless response system interacts with our domestic violence response system, using that term kind of loosely. Domestic violence and gender-based violence means a lot of things. We're going to get into that. But we haven't taken a lot of time to talk about that intersection and figure out what does it mean for us as leaders in the homeless response space to have those partnerships. The intersection has been there for a while. I know our laws have included in category 4, at least for the Continuum of Care program and Emergency Solutions Grant program, the idea of serving those who are fleeing domestic violence, stalking, dating violence, and that's been expanded over time to include other categories of gender-based violence. Very, very important. But again, that didn't necessarily in and of itself break down silos. Often we were still operating in somewhat separate systems that needed to converge to be able to effectively do what we want to do. We've seen incentives over time that have helped us bridge that gap. Obviously, we serve often folks who fall into various definitions of homelessness and people experiencing gender-based violence, whether they identify as experiencing gender-based violence or not, are served in the entire homeless response system. And so whether or not, again, they receive targeted services, they're a part of our system. It's unfortunate to consider just how many people have experienced that as part of their life in general, but really on the streets and in a homeless situation. It's awful. It's very bad. There are certainly some regulatory assistance here. Again, I mentioned the definition as something that says folks can be served who have experienced gender-based violence, and that's a really important concept. We've seen incentives in terms of funding, certainly, and I'll talk in a moment about DV bonus and how that's important to this schema. But funding has kind of been part of the allowance for a long time, but doing that well is a whole nother story, right? How do we ensure that our entire homeless response system is friendly and serviceable to those experiencing gender-based violence? Let's go to the next slide, please. So there's a little bit of data that kind of walks us through some of the history. I always like to see what it means in terms of data. What does the quantitative data tell us about our experience over the past couple of years? We've certainly seen some changes with the actors we've worked with, right? We've often worked with victim service providers, but many of our programs serve those experiencing gender-based violence, whether or not they are victim service providers, whether or not they're targeting those who experience gender-based violence, or just serving the more general homeless population. Historically, transitional housing was the core place where we would see those services provided in the Continuum of Care program, at least. ESG, we'd also see services targeted to folks experiencing gender-based violence, often in sheltered situations, but actually many of those shelters were funded in other ways. And we look to some of our other partners, like the Department of Justice, who has done a great job providing services to people experiencing gender-based violence. I want to look at the graph that's on the screen here just briefly. It gives you a hint for what's happened with funding and incentives with funding. So DV bonus obviously comes into play here. If you look that 2014, I just use that as the baseline. That's almost 10 years of data, or it really is 10 years of data for this purpose. We saw kind of a downward trend. It was slight, but it was real in terms of how many programs were targeted to people experiencing gender-based violence. Again, funding was slowly going down. That was intrinsically tied to the transitional housing going away, right, as we were pushing more for rapid rehousing. It took a little while for that to be something that was more broadly available to those experiencing gender-based violence. And so not surprisingly, we saw things ticking down. Well, the first year of domestic violence bonus funds was 2018, and the graph shows that, right? You see a change there, an uptick. That funding has continued to come in every year. And now we see that growth in the percent of folks who identify as having gender-based violence. It was at a low, somewhere in like the 12 to 13% of those projected to be served in our project applications, to now being over 20%. That's a large part of our population. And we're excited to see that and continue to see some interest and growth in the collaboration in ways that aren't seen in some of the data here, right? This focuses on residential projects, but we've seen efforts to improve our coordinated entry system as well. We love that. That's a reflection of collaboration and the need to move things forward. So that's just a hint of some of the history that we've had here. I'm going to turn the time over to LaToya, who actually has years of experience here and really comes with a strong background in the efforts that will have the most meaning from a practice and everyday perspective. Turn it over to you, LaToya.
Thank you, William. Hello, everyone. So I wanted to talk a little bit briefly about what we mean when we say DV or domestic violence, because a lot of times we refer to the DV bonus. We may say survivor of domestic violence, but really, while the acronym DV is generally understood to mean domestic violence, and we use it a great deal within our NOFA, right, as it refers and relates to the DV bonus, we really consider that it refers to all of the 4 VALOR crimes without priority to domestic violence in particular. And so I wanted to just kind of outline the definitions of what we consider domestic violence, dating violence, sexual assault, and stalking, because all will be covered not only under VAWA, but also under paragraph 4 of homelessness. And so one of the other crimes that is not listed on here is human trafficking. Although it is covered by category 4 of the homelessness definition, it is not something that is exclusively covered under the DV bonus. Although human trafficking survivors could be survivors of both domestic violence, dating violence, sexual assault, and stalking. And so here's just some information just so you can have that really just kind of outlines how we defined it, and that it's more than just domestic violence. And we want to really be clear that we are acknowledging that. Really the 4 VAWA crimes, and I'll talk a little bit about VAWA next, they are specific victimizations specified by Congress. And so it's much more than that, and we want to just recognize that. And so thinking about VAWA, most of you may have been a part of our trainings that we've been doing since August of 2023 that really speaks to what VAWA is. VAWA is known as the Violence Against Women's Act. And in March of 2020, it was reauthorized, amended, and strengthened the protections for survivors of domestic violence, dating violence, sexual assault, and stalking. And so here are the existing VAWA protections that really spoke to what existed prior to the VAWA 2022 reauthorization. And so one of the things that I did want to note is that the VAWA 2022 included new and updated housing provisions that took effect October 1st of 2022. But prior to that, some of the existing VAWA protections included the protection against entering personally identifying information, notification, confidentiality, emergency transfer plans, the prohibition against denial of admission and eviction, documentation requirements, lease addendums, and lease bifurcation. And so with knowing all of that, we want to just make sure that we understand that this all applies to all COC and ESG recipients. And so there are different program compliance standards depending on the program component, but they apply to all ESG and COC recipients. Next slide, please. Before I go on, I wanted to just mention, because we say violence against women, and I want to be clear that VAWA, although the title refers to women, that its protections apply equally and completely to people of all genders, okay? And so with the expanded VAWA 2022 provisions in particular, These provisions really kind of expanded on some of the existing provisions, but also added a few new ones, particularly around the definition of domestic violence. It revised the definition to include economic and technological abuse. It also changed the McKinney-Vento homeless definition, which is also known as Category 4. And then it also added a new enforcement authority under FHEO, which is HUD's Fair Housing Department. It did a prohibition on retaliation. And then it also added the VALOR budget line item, which is our COC program eligible activity. The right to report, which applies to any and all. And then also the compliance review process. Some other provisions are listed here as well, which added a new gender-based violence office, technical training and technical assistance money, and then also a study on the needs of survivors of human trafficking. Next slide, please. So in thinking about, right, William spoke a little bit about the DV bonus, and I kind of added on the VAWA and then all components of how we identify domestic violence, sexual assault, dating violence, and stalking. There are expectations, right? Because I think a lot of folks want to know, like, well, what does HUD want from us? And I feel like a lot of times we look to the NOFO and we may look in other places. So we wanted to kind of just really kind of outline a few of our expectations, which really speak to the engagement and investment in serving survivors of domestic violence. And so that means that we're looking for active investment and participation. And that means there's coordination between the COC and victim service providers, right? There's a shared leadership, which means that COCs and victim service providers are intentional around fully engaging with each other and also engaging survivors, right? We want to make sure that we recognize survivors as experts and that survivors are a part of leadership opportunities, and that we identify them as persons with lived experience and expertise as well. We also want to make sure that folks are constantly prioritizing survivor needs, really looking to really identify effective ways to serve survivors and to strengthen community capacity. One of the other things that's really key to actually doing this collaboration is to really be aware of your flexibility. We recognize that it's not a one-size-fits-all approach and that there are different geography and coverage, and that may require different needs. It may require different partnerships. And so we want you to be really keen on how you understand your flexibility with that. Also looking at your program design, like data requirements. I'll talk a little bit about the data as well and some best practices around that. But really, what's really important is that we at HUD, we recognize that, you know, everybody doesn't have it going on from the start, but the goal is to constantly seek to improve, which means there needs to be an ongoing commitment to improve. And so what that looks like is really creating a culture that provides cost system training, looking at technical assistance. How are you tapping into your resources that are internal or external, right? Looking at program evaluation. How are you looking at what's working, what's not working? Are we hearing from the people that we're actually serving? How are you raising awareness? And how are we constantly learning and trying to improve? Next slide, please. Thank you. And so when we look at best practices for actually building the collaboration, we want to think about building strong partnerships. Strong partnerships can help you collaborate with other organizations in your community that are also working on gender-based violence, prevention and response. And the goal is to really leverage resources, share best practices, and increase your impact. Thinking about training and capacity building, these are things that are essential components of implementing serving survivors effectively. COC and ESG grantees need to have the knowledge and skills to understand the dynamics of trauma-informed care, abuse, best practices for working with survivors, so that you can do it effectively. Thinking about reporting and data collection, you want to do it in a way that's safe. And so what that means that you're collecting and analyzing data on the prevalence and impact of gender-based violence, and then you can identify areas of improvement and make evidence-based decisions to better serve survivors. You want to also constantly be engaging with survivors, right? This is a crucial aspect of working with survivors and working with victim service providers for COCs. And so that means creating survivor-led support groups, involving survivors in the development of policies and programs, right? And so approaching survivor engagement with empathy and respect, and recognizing survivors' experiences as unique and valid. And then also, a part of that is addressing intersectionality and cultural competency. And so that also looks at recognizing the impact of race, ethnicity, language, religion, gender identity, that services are accessible and inclusive. And last but not least, we always talk about housing first. And so being grounded in housing first means that we recognize that everyone is housing ready. And we do not exclude people from services based on when they experienced violence or their last experience, or if they did or did not. The reality is that whether folks are disclosed or not, or whether we are dedicated to serving survivors, we all are serving survivors. And so the goal is to really make sure that we can work together to collaborate to do this work better. That's all for me. Joe, I'm going to hand it over to you for questions.
Okay. Thank you, LaToya, and also thank you, William. Okay, for now, we do have a little time to ask, for you to verbally ask 2, perhaps 3 questions. So if you would go ahead, if you have a question, raise your hand and you will be recognized, and then you will be unmuted. You'll be allowed to unmute yourself. So with that, any? Okay, so we're waiting for Sophia, but I'll tell you I'll ask a question real quick that's in the
Joe, so sorry. We have Veronica Wilson. Veronica, if you want to go ahead and unmute yourself.
Hello.
There you are. Tell us who you are with, and then ask your question, please.
Hey, my name is Veronica Wilson, and I work for Mendocino County Social Services in Northern California. I'm the COC coordinator. And I had a question related to the COC DV bonus funding. It's been available like since 2018, that like William said, but we haven't had any local organizations request that funding at all. And I've spoken extensively we have one VSP in the community because, you know, it's rural and we're lucky we have one that's right here in the center. And we have one more who works with families exclusively. But they're really hesitant on accepting federal funding. All of their funding is state or local, and having that level of, you know, regulation and understanding, you know, like with the financial requirements, we ran into some issues with ESG CV whenever we expanded that with not quite understanding 2 CFR Part 200 and the financial requirements. And so there's just a lot of hesitation with these smaller organizations on stepping up and being part of these collaborations and accepting this funding. You know, there's those things. And then there's also, they have their state allowed practices that may not quite align with housing first. And so there's just a lot of different factors that come together. And I'm just wondering if any of the panelists have thoughts or anything to share on overcoming that trepidation.
Thank you, Veronica.
Thank you, Veronica. That's a really, really great question. I think what you're speaking to is a lot of what William talked about, which was, historically, folks have worked in silos. And so the goal is to help fold people into and bring folks out of their silos to really work together in partnership. And so some of the best practices I listed here really kind of outline that, particularly because, it's important for us to do the cross training, right? And so what happens is, even though the NOFO, right, is currently released annually, there are opportunities maybe throughout the year that I will say that we can, that folks could partner or can kind of help introduce somebody into the fold of like COC funding and invite them to different webinars and share. I don't think it's an overnight thing, right? It's really about focusing on what can be done, because like you mentioned, Veronica, Housing First may not work for everybody, or everybody may not, subscribe to it. However, there may be components of Housing First that do work. And so maybe building on that to see where you can start. Is there a starting point? How do you begin to have those conversations? I know for a lot of the providers that we've worked with, and even for me coming from the victim services background, confidentiality and consent has been a huge part of the pushback around data sharing, around, funding requirements. And so it took a lot of time and a lot of work to just build on working on trust, right? How do we build trust, right, in this small space first, and then kind of work to expand that. And so once you kind of work with what you have, which is just, let's just talk about it. What are your fears? But also, where are there some common areas? You can use that to really try to build on further in collaboration.
Let me add
Okay.
just a little bit more, because LaToya's answer was great. And LaToya, again, came from DOJ. She actually came with that perspective as well, and like understands the COC program is different, and sometimes not very friendly different, not intentionally, but it does come across that way. We actually have a few people who come from the DOJ side, and it's great because they have actually contributed, saying, no, you got to rethink some of the framing, some of the way we consider various aspects of the program. I think a couple other things we've seen in communities is we've seen sometimes the COCs interact in different ways with VSP partners or again, other partners who specialize or target their services. Sometimes that means they actually do direct grants and they sub to the provider to take some of the weight off, to deal with some of kind of the morass that comes with doing federal programs. We've also seen partners, actually today we have Jennifer and Grace. They probably have great ideas and have had to help bridge some of that gap. I bet they have some great ideas. I know they do, but they're also kind of a source, a resource to be able to help us overcome some of the differences. And as LaToya said, an area where they can help us identify where are the commonalities and how to focus on those and let those be the leverage points. And don't get too bogged down in some of the stuff where you can avoid it, things that don't actually have to impact the grant. There are definitely some things that we get focused on that actually don't have to intersect with how the grants are operated. So great question.
Okay, so we only have time for one more question for LaToya and or William, and before we continue on with our other panelists. So one more question.
We have Tanya Torno. I believe she's with actually the County of Riverside COC. Go ahead and unmute yourself, Tanya.
Thank you so much. Good afternoon, LaToya. Hi, William. So nice to be with you guys today. I did not have a question, but just wanted to comment and acknowledge that we have greatly appreciated the DV bonus funds that have been provided to our county. We locally are partnering with 3 agencies, our subrecipients who are administering rapid rehousing services. And we, with your guidance, we're very intentional about, figuring out how to make connections with our local victim service providers. So one of the very first things we did was to draft an MOU with those agency providers and then the local victim service providers, because one, we knew that without something like this in place, those VSPs would be very hesitant to come to the table with us, and for good reason, right? And I just want to say that it has worked out very well. We have monthly meetings now where we coordinate referrals with our coordinated entry system. We facilitate case conferencing, and even now we have a partnership with the California Partnership to End Domestic Violence Coalition at the state level, and have representation there to still try to figure out how we can further enhance our program, and then look at applying for other grant opportunities to expand what we've been able to begin through the DV bonus, recognizing that housing is a critical component, but there are so many other ranges of services, workforce, as an example, that families, individuals, survivors are going to need. So just sharing that as a comment to say that, one, we thank you. An MOU is a good idea to be able to accomplish all the different components that you've talked about. So thank you.
Okay, so thank you, Tanya. Unless, Latoya, if you were going to make a quick little comment about that, want to move on to Doc Shika?
Yeah, thank you, Tanya, so much. We really appreciate that feedback. And absolutely, a MOU is a great idea. I also have some resources, Joe, if you could go to the next slide, that we provided for you guys. So take time and, use these resources about like just some FAQs, just when to use a comparable database, safe housing partnerships, which is a federal technical assistance partnership. There's also other resources on improving access for survivors, which is new. And then applying for DV bonus projects. And HUD does have a VALOR page, which has other program offices information and all the kind of HUD information in general that pertains to Violence Against Women's Act. And then as always, feel free to hit our AAQ desk and ask a question if you have additional questions. Thank you, Joe.
Okay, thank you, Latoya. Thank you, Tanya. And we'll now move on to Doc Shika.
Thanks, Joe. My name is Dakshika Vikrama. I work at the state. I'm the Deputy Secretary of Homelessness for an agency called the California Business Consumer Services and Housing Agency, also known as BCSH. Thank you for inviting me, Joe, and happy to be here to really think about and maybe hopefully provide some suggestions around the listeners heard from William and Latoya around this potential opportunity, and wanted to give some ideas around how the state programs, the state grants, the state guidance could be hopefully a support as you guys think about the collaborative application and potential projects. So on this slide, I'm just going to go through and talk about some of the principles and guiding priorities for the state, especially the state funding programs, which many of you already know about, but I'll name a few of them. For example, HAP, which is the Homeless Housing and Prevention Program, and then the Encampment Resolution Fund grant, as well as the Family Homelessness Challenge grant. And then within the HAP program, there's also a tribal set aside. In all these grants, there is an emphasis on regional collaboration and strategic partnerships. So similar to what Latoya was talking about, as you apply for the state grants, there's an opportunity to really think about leveraging the state programs with the federal programs and think about those strategic partnerships so that you're getting more bang for your buck across local, state, and federal programs. So for example, if, and I know there are a few jurisdictions through the Family Homeless Challenge grant that really focused on domestic violence populations, there might be an opportunity to go and seek a way to really expand on that Family Homeless Challenge grants through the DV bonus. Or think about the HAP program. If there's a focus on domestic violence, is there a way to leverage those state grants with the DV bonus from the federal government? In the tribal HAP program, which is a competitive grant, which many COCs don't really do a lot of work with, but I would encourage COCs to really think about their tribal government partners. There are 109 federally recognized tribes in the state of California. They all receive tribal HAP. There's an application out right now, which will end in June. And within tribal governments, there might be an opportunity to do something related to domestic violence. So I would encourage all of you to think about those state programs that you already have, which are multi-year programs, or programs you're about to apply to, and think about what the opportunities might be around DV bonus and leveraging those state and local dollars. I also want to remind everybody, as LaToya mentioned, California is a housing first state. That doesn't mean that everybody is complying or following housing first principles, but that is something we really want to make sure that people are thinking about as they think about trauma-informed, person-centered, culturally responsive approaches in all their programs, whether it's an outreach program, whether it's an interim housing program, whether it's a permanent housing program, whether it's a supportive services program. How are you really including ways to make the program trauma-informed, person-centered, and culturally responsive? So these kinds of directives are written into all the state grants. So would also encourage people to think about how those kinds of ideas are being woven into your collaborative application and your DV bonus project, which LaToya has already provided a lot of information on, but want to just emphasize from the state's perspective as well. We think that's important. And then lived experience and expertise. Many of you have in the COC lived experience advisory boards, hoping that those are kind of part of the conversation as you think about program design and opportunities to expand and leverage, and especially people who are survivors of domestic violence. Or even, as LaToya mentioned, there are multiple ways domestic violence can be captured with different populations, especially, and I'll call out our youth population, the 18 to 24-year-olds, thinking about the different ways that they may be survivors of violence and how their voices are included in program design and opportunities to expand and leverage federal, state, and local programs. I will mention on that piece that the HAP program has a 10% set aside for young adults and homeless youth. So that is again an opportunity to think about in your local jurisdictions, and reminder that HAP goes to all 58 counties, all 44 COCs, and the 14 big cities in California. So think about how that youth set aside might be an opportunity to think about expansion or a program related to the DV bonus. LaToya mentioned this, but also important in the state is really addressing racial disproportionalities and disparities, specifically when it comes to people who are Black or African American or our native populations, thinking about how people are tracking and reducing those disparities. People are tracking overrepresented populations and neighborhoods as you think about DV bonus or ways to expand and leverage federal, state, and local funding through your collaborative application. And then the last two things relate to data, but also cross-sector plans. In all our applications that I mentioned, there is a requirement to really think about getting feedback and input from domestic violence providers, but also the healthcare systems, the social safety systems. And there's a lot of, LaToya used the word intersectionality, because that is absolutely what people need to be thinking about, not just the homeless system, but also the healthcare system, the Medicaid system, the social safety net system. How are all those systems working together to really think about the needs for domestic violence survivors, and how are those systems working together? That is something that takes time to kind of craft those relationships, but I guarantee you there are so many benefits to even beginning to think about those relationships at the local level as you think about cross-sector opportunities, especially because many times funding in the homeless and housing space is one time versus the funding in the health space, in the mental health space, in the social safety net space is ongoing. So how can you really think about how you leverage and connect those systems as we think about DV bonus and kind of expanding existing state money. And then the last thing is Senate Bill 914. This is something folks in California are aware of. It is really looking at how we can really think about planning and including data connected to domestic violence survivors. The partnership is helping us really at the state level to reach out to our partners across the state as we think about how we start planning and implementing data that is inclusive but still culturally responsive and makes sure that people feel safe, but also we can use this for long-term planning as we kind of think about how all these systems interact with each other. The last thing I'll mention on data, so we can go to the next slide because it's connected, Joe, thank you. On the data piece, William showed a slide around how many people were captured that were experiencing domestic violence. The state has a system called the Homeless Data Integration System that rolls up all the HMIS data from the 44 COCs in the state. And there is a link on this page that's under data, the BCSH CalICH HDIS webpage, and you can see the data for last year, calendar year 2023, and 22% of the folks being served by HMIS systems across the state were people who reported experiencing domestic violence. Probably an undercount, but just wanted to say that that's the data that is available right now through the HMIS systems. That's about 60,000 adults or heads of households over the last calendar year. But as SB 914 gets going, we will be able to really capture much more comprehensive information that will be useful, not only for this conversation, but for other conversations around cross-sector planning. On this slide, I just had a couple of links that might be resources for all of you. So I would encourage you to familiarize yourselves with this. The meeting link shows the public meetings that the Interagency Council on Homelessness has, where we'll be discussing over the next 3 meetings, the new state action plan, which will be a 3-year plan, and there will be focuses on different populations, including domestic violence survivors. So please join in and provide your public comment during those plans. And then I also wanted to point out under other statewide resources, what I mentioned around the importance about thinking about the healthcare system and the social safety system, where there are stakeholder calls that I would encourage the COC partners to really familiarize themselves with and join, because there might be some good connections for our DV population that we are not aware of, that we could start forging those relationships now. So that I'll stop now because I know we want to spend some time for questions, Joe, and I'll turn it over to you.
Yes, thank you, Dr. Shika. So yeah, we have a little bit of time to ask Dr. Shika a couple questions, to ask 2 questions. So if you would like to ask one of those questions, please raise your hand. You will be recognized, and then you will be allowed to unmute yourself. It's Sophia.
Yes, I do not see any hands at the moment. We have 91 attendees, but I don't see any hands raised at this moment, so.
Well, I'll take a quick moment then just to say, Dr. Shika, that, you know, one of the things that you bring, you know, and through BCSH and through CalICH and everything is that through the state action plan, you know, and in the state action plan, which was recently revised, there was several places where it says collaborate with the COCs, collaborate with the COCs, collaborate with the COCs, you know, and so that makes that plan especially special for many of us. And there is over 100 of us on this call, for many of us on this call, that represent the COCs throughout California. So quick comment, Dr. Shika, or sure?
No, thank you for mentioning that. Yes, the plan is in the process of being updated. It used to be an annual plan, and it will become a 3-year plan. and part of that is really taking a closer look at how we can really think about long-term achievements. So for folks listening, it's really for the state family. So there are 4 cabinet level agencies and 14 departments that are represented on the Interagency Council. And as Joe mentioned, there's a lot of direction to really collaborate with the COCs, as also direction to continue to use trauma-informed approaches and culturally appropriate approaches, because we want to make sure at the state level that the same messages we're sending to the local level are that there's resonance at the state and local level. And then since there's no question, I just want to point out, and the DHCS link, in case people are not tracking, there's a new bond, Prop 1, which again will have a lot of resources for behavioral health and mental health resources. So might be really good for people on this call to take a look at it. It's not the usual homeless and housing kind of resources, but sometimes key resources for a domestic violence population.
So
Thank you.
I'll
Thank you,
quickly.
Dr. Joe, there's a
One
raised
hand. I was
hand.
going to say before the raised hand, before Pat Leslie comes on with the raised hand, I was just going to say that I know William and I know Latoya and I know Dr. Shika and several, and I know there's other state staff that are on this call as well. You guys have all these meetings and conversations, that are going on between you that we're not part of and so forth. And so I just want to just acknowledge that, because I think that's something that's very special to California, is when HUD and the state working so closely together.
That's right. William and I on several calls on a frequent basis to kind of make sure we are coordinating.
So with that, okay, I know, Sophia, you want to acknowledge Pat for a quick question and a quick answer so that we can move on to Jennifer.
Yes, go ahead and unmute yourself, Pat.
Counterintuitive is that when we talk about flexibility and we talk about intervention in domestic violence situations, we talk about responding to, right? What flexibility, what innovations can we look at across systems to actually look at some prevention? We have some indicators of likelihood of DV or early indications of trauma. What suggestions, or how might we look at supporting and funding prevention as well?
Great. And you're talking about the state funds, right, Pat?
Yes, I am.
Okay, great. So in the HAP round 5, there is a prevention kind of category, Pat, and all of the things you mentioned, because it's pegging itself to the kind of the imminent risk category. That's the same hard things, but domestic, you can kind of provide the rationale to the state grant staff if you want to use prevention in the ways you're talking about, Pat. So it's really up to the jurisdictions, and that's why HAP is quite flexible. And you can, if you want, don't think I did it. The HAP NOFA is in the, I'll send it to Joe, and Joe can make sure that Pat sees that. There has the kind of the prevention criteria, which is really up to the locals to kind of provide that rationale on the imminent risk. So if you can make the case, Pat, that folks experiencing domestic violence, like you said, upstream before they even hit the homeless system, there's a potential to use prevention dollars through HAP.
Thank you.
Sorry, this opportunity is over, but Family Homeless Challenge also had many jurisdictions where they focused on domestic violence, both on the prevention side and the intervention side, Pat. But that is a good question.
Thank you, Dr. Shika. So we're going to move on to Jennifer.
Thanks, Joe. Hi, everyone. It's nice to be here with you all. As mentioned earlier, my name is Jennifer, and I am on the policy team with the California Partnership to End Domestic Violence, which is California State Recognized Domestic Violence Coalition. We often are referred to ourselves as the partnership. So our work represents the roughly 1,000 survivors, advocates, and organizations and allies across the state who are involved in our efforts, which include working to pass legislation on behalf of survivors and their families, creating system change through prevention, communication, capacity building programs, and holding space for just community and healing. An important thing I wanted to note is that at the coalition level, we do not provide direct service, but we do support the agencies throughout our state who do that work day in and day out. Why I have you all here, I wanted to really focus on talking about our work around housing, which includes supporting survivor-centered housing efforts at the local and state levels, as well as within a variety of community collaborations. Because you all know that housing insecurity and domestic violence are fundamentally linked, and because neither of these issues can really be addressed alone or in the silos that we've mentioned, we've really prioritized our housing work over recent years as an extension to the economic work that the partnership has been working on previously. And so some of that work includes, as Dakshika mentioned, supporting the implementation of SB 914, also referred to as the Homeless Equity for Left Behind Populations Act, or the HELP Act, which seeks to improve the state's homeless system response to survivors and ensuring survivors are properly included when addressing homelessness for those specific populations. We also work to expand and deepen collaboration across the state by supporting a couple of efforts and specifically some cohorts and work groups. So one of these cohorts that the partnerships support is called the Home Cohort, which is made up of 11 of our member agencies. So they're domestic violence serving agencies who are working to address the intersection specifically on housing and homelessness for survivors and economic justice work for survivors and women in California. And then more recently, at the beginning of this year, we also established a working group that's made up of staff from domestic violence agencies, survivors, and housing service staff from a variety of housing agencies. We even have a couple COC staff on there and some HAP program staff as well. And so their focus is really to improve collaborations with counties, with each other, and then with states and other housing entities, including you all throughout the state. And then in addition to these projects that we have, we do elevate discussions throughout the year around perhaps successful case studies of folks working to address the needs of survivor housing. We also have webinars and for educational opportunities, as well as talking about housing legislation and how our member agencies can apply that to their work. In the next slide, I'm going to talk to you all about collaboration. And so when talking about—
Can I interrupt you one moment real quick on this? Because this is so, William used the word historic when he first said, I mean, this and what Grace is going to do too is this very historic for us, because every year COCs are asked, hey, do you collaborate with the state, domestic violence coalition? Do you collaborate with the state sexual assault coalition? And here you're saying, hey, okay, you guys want to answer this question? Listen up.
Yeah, thank you, Joe. And I know the other panelists have mentioned the importance of this, and I think have also kind of emphasized that this can look different, and it is going to look different depending on folks' geographic space and just what their communities look like. But when I was envisioning talking about the types of collaboration, I wanted to emphasize like what that could look like at the coalition level, as well as at the local level with your local service providers in your area. And so in terms of the coalition level, I did just want to highlight a couple things that the partnership, we do have membership options. So if you, as you heard me kind of mention, member agencies, and we have 2 tiers of membership. So the tier 1 is a lot of our direct service providers that are DV agencies or sometimes dual domestic violence and sexual assault agencies. And then we also have a tier 2, which is for allied organizations. And so Being a member of the partnership would get your organization access to our member-only events, which include monthly regional spaces, more exclusive information through some listservs that we have, membership newsletters, and policy alerts. So some deeper dive into the policy efforts that we're working on, as well as some other resources. For those who are interested, I can share the membership information in the follow-up email as well with the slides. But for those who maybe membership isn't an option or interest for you, you definitely could still have access to our resource library on our website and other public events and webinars that we host, which you could encourage staff to attend in order to continue learning and continue that effort in improving collaboration. I will also invite you, we have an annual statewide conference, which this year is virtual, and it has been virtual, and sometimes it will be in person, but I encourage you to attend that as well, which has a variety of workshops, not only on this specific intersection, but a lot of other key issues that intersect with domestic violence and economic justice work as well. And then in addition, we have at the partnership, we provide technical assistance for our members on their end of trying to collaborate deeper with other agencies and entities. And so I also welcome connection for folks to reach out for training or technical assistance if you have any questions. If you're very interested, but you maybe just don't know where to start, or you're looking for some direction, my information will be in the follow-up materials, and I encourage that. But I also, to transition into the local level, I will also probably encourage folks to invite your local provider in your area to come train your staff and provide that assistance as well. Or if you have any specific training request needs, talking to the local domestic violence service provider around ways that you all could improve serving survivors, and they probably would be happy to provide that training as well. Looking at the local level, I feel like definitely we've touched on this a little bit, so I'm going to highlight some work again. But if you don't already have a relationship with your local domestic violence provider, I would first encourage you to do so and reach out and get connected with them. In the follow-up materials as well, I've compiled a list of our member agencies, so the domestic violence agencies throughout the state, and they're listed by county, so that if that's something you're interested in, you can reach out to them. It has their contact information. And as some folks here have mentioned, depending on what county you're in, you might just have one domestic violence service provider or one victim service provider. You might have a lot, or in some cases, there might not be one in your county, but there is one in your neighboring county. And so you can look it up that way in order to get connected to folks. And then my other recommendation would be just elaborating on what folks said earlier in terms of creating a welcoming space for domestic violence service providers to participate with the local continuum of care on some level, whether that's on the board, in a committee or a subcommittee, or even I have heard of some jurisdictions creating a domestic violence specific committee as part of their charter, so that they can have that committee specifically focusing on ensuring that survivors are adequately included in the work that you all are doing. Although some have that in their charter, I wouldn't say that it necessarily has to be formal or written necessarily, but just extending that invitation, building that relationship, and so that they know, even if it's a learning curve for them or for you, that it's a welcome space for them to get involved. And then to emphasize, as we mentioned earlier, the importance of survivors being involved. I know many of you have lived experience, folks on your board. And so I would just also encourage, as you work on those relationships, or if you already have that relationship, being intentional with your outreach, perhaps for lived experience seats, and connecting with your local provider to share that information with folks who have dual experience as a survivor of homelessness, as well as a survivor of gender-based violence, so that they can be involved in the decision-making process and share their multi-lens perspective on the work.
Cool.
Okay.
Okay.
And we're open for questions.
Yes, all right. So we'll have time maybe for a couple questions for Jennifer. If you could go ahead and just raise your hand, you will be acknowledged, you'll be called upon, and then you will be allowed to unmute yourself. So please go ahead and raise your hand.
I do not see any raised hands, Joe.
Okay, I'll take a quick minute though and say, Jennifer, just to pull you back in for a moment. I mean, really, this, as William said, in some ways, this is very historic for us because every year COCs are asked in the COC application, do you collaborate with your state DV coalition? You know, and here you are saying, okay, folks, that the application is going to come out soon, and let me help you in terms of answering that. So really appreciate that. So I don't know if you have a last comment at all, Jennifer, at all, or just.
I mean, I echo that it is historic, and when this opportunity was presented, we appreciate it. I appreciate it because this conversation is so important to have, and so for you all to hold the space for us to make that connection and present this is really valuable.
Okay, with that, we're going to go to Grace. You're on.
Joe. Thank you. Hi, everyone. Thank you so much for having me here today. I'm Grace Glazer. I'm the Public Affairs and Policy Manager with VALOR, and VALOR is a California-based national anti-sexual violence organization and California Sexual Assault Coalition. So we represent the 84 Rape Crisis Center programs across the state, and then we also have a few national programs that include Prevent Connect, which is our online prevention hub for violence prevention, and Reliance, which is engaging businesses to partner with local programs around preventing sexual violence. One thing that I really want to elevate in our time here today is drawing the connection between housing and violence prevention. Stable, secure housing is a protective factor, right? And so when we are able to work together, we can ensure that survivors are not at risk of being re-victimized or re-experiencing sexual violence. And similarly, if someone is in a safe, stable housing environment, then they're not at risk of experiencing sexual violence. So as my colleague Jennifer, who I spent so much time working with, the partnership's wonderful policy and comms team, they are a joy to work with. There are a lot of differences between sexual assault survivors and domestic violence survivors and their needs. And I think a lot of times that gets lumped together. So I just want to take a few minutes to talk about what the differences are around sexual assault survivors and housing. And a lot of times when we're thinking about sexual assault and housing, we don't necessarily connect the dots around those two, but it's equally as important when we're thinking about supporting a survivor of domestic violence. Ultimately, our goal is to prevent and end sexual violence. And when we can support a survivor in accessing safe, stable housing, helping them get out of a dangerous situation, teaching them about primary prevention, teaching your communities about primary prevention, then ultimately we're working together across this continuum of care and supporting survivors. So as I mentioned, VALOR represents the 84 Rape Crisis Center programs across our state. So there's about one per county, or in more populated areas such as Los Angeles or San Francisco, Bay Area, there are multiple rape crisis centers that support survivors. These programs are available 24/7 with a support line. And then they also operate during like normal business, usually about 40 hours a week, and are fully staffed with counselors, advocates, therapists, anyone and everyone who can be helping a survivor during a time of need. It's also worth mentioning that because sexual assault and domestic violence are so interconnected, that a lot of our programs are dual rape crisis centers and domestic violence programs. So in California, we actually only have 12 standalone rape crisis center programs. So with that, I would strongly encourage building relationships with your local rape crisis center. On VALOR's website, we have a Get Help section where you can find rape crisis centers by county, and there's contact information to reach out and start building those partnerships. Because as I said, if we're working on one end of the spectrum to advance equitable housing opportunities, that's ultimately violence prevention. So whether you realize you're doing violence prevention or not, and I think Pat was someone who brought it up earlier, I was talking about prevention, but when we work together in our communities to think about the needs of survivors and think about the needs of people who are at risk of experiencing homelessness or are experiencing a housing crisis, then together we're working to prevent violence and creating safer, healthier, equitable environments. In addition to working with some of our rape crisis centers, if you're interested in getting more involved with VALOR, as I mentioned, VALOR is both statewide and national. So on odd years, next year, we host the National Sexual Assault Conference, and it'll either be in Northern California or Southern California. So next year it will be in Anaheim. And that convenes about 2,000 people every August from across the country to think about what our national agenda is to prevent and end sexual violence. It is an incredible conference opportunity, and I would strongly recommend you all consider attending. If you are interested, you can sign up for that listserv on VALOR's website. And then when we're not hosting the National Sexual Assault Conference, we are hosting our statewide sexual assault conference. So similar to how the partnership has their domestic violence conference, we have our sexual assault conference. This year it'll be August 28th through 30th in San Diego. It's at Paradise Point Resort and Spa. I was so excited to find out that it was at somewhere so beautiful like that. And at that conference, we focus more on what are the needs within California and how can we be collaborating across disciplines to advance the rights of survivors and end sexual violence. So if you are interested in attending that, we will be opening registration next week and very excited to be welcoming about 400 folks to San Diego. And then lastly, we also have opportunities for membership. So we separate between our Rape Crisis Center members and then non-Rape Crisis Center members. For you all in this space, most of you would fall under the non-Rape Crisis Center member opportunities, and we have individual, nonprofit, and business or for-profit opportunities. And when you become a member, it gives you discounted registration rates for both of the conferences that we host, access to our learning hub, and additional like newsletters, weekly digest, content that comes out from VALOR staff that's focused not only on just policy work, but also on prevention, intervention, and providing training and technical assistance. And then lastly, I just wanted to highlight that as we're thinking about what opportunities there are for collaboration between local organizations, state organizations, that we all play a really vital role in ensuring that California is a safe, healthy environment for us. So I would strongly recommend forming those relationships with your local Rape Crisis Center programs. And if for any reason you have a hard time connecting with them, please don't hesitate to reach out. I am one of many people on VALOR staff that would be glad to help you connect to your local Rape Crisis Center. So with that, I'll pass it back to Joe.
Okay, thank you, Grace, and really appreciate you sharing this. Again, it's so timely with the COC application coming out in just perhaps just in a few weeks from now or so. And COCs will be in a better place to answer that question. Those questions, how do you collaborate with your state sexual assault coalition, as well as we noted with Jennifer, and the partnership. So with that, perhaps we could spend a few minutes. If there is a question or two for Grace, please go ahead and raise your hand and you will be acknowledged, and you will then be unmuted, or you'll be allowed to unmute yourself. So please raise your hand. Sophia?
I don't see any raised hands.
Okay, so with our remaining time, we want to do a couple more things, and
Joe, maybe since we do have time, a little bit of time, there was a question initially on human trafficking, and the question was from Peter Bell. Why isn't human trafficking included in the DV bonus funding? Was it an intentional omission?
Yeah, I can answer that one. In the appropriation that authorizes the funding for DV bonus, it uses specific wording to define what domestic violence is inclusive of. It does not include human trafficking in that. So while we would love to use our more expansive definition that we use in the competition, we're actually limited or using the category 4 definition, which would include human trafficking. Because of specific language in the appropriation, we have to say you've got to meet the definition as applied or as indicated there, which again, as LaToya mentioned, could include people experiencing human trafficking, but they must be able to make that direct connection between the definitions in the appropriation.
Okay. Thank you, William, for that. So what I'd like to do is go on to our next slide as we kind of wrap up our time together, and note that that you are encouraged to raise your hand and verbally share comments or observations or suggestions or next steps about advancing our federal, state, and continuum of care collaboration to end domestic violence and sexual assault. What this means is that this is not a time to ask more questions. What you're being asked to do here is to take a little bit of time, I'm talking to attendees, take a little bit of time and to make comments, not ask questions, but to make comments in terms of what you feel should be perhaps next steps here. And while all of our panelists are still on the call with us. So I see Clementina's got her.
Yes, Clementina Burhan from the LACOC. Please go ahead and unmute yourself.
Hi, Joe. Just want to say first, thank you for putting together such a great group to discuss such an important topic as advancing federal, state, and continuum of care collaboration. For the panelists, thank you for providing very informative presentations. For your awareness, LASA has a specific unit consisting of 4 people that specifically focus on this issue. So just, wanted to throw that out there. And then just personally, I appreciate the collaboration from the DV community, state, and federal groups, and I look forward to continuing to strengthen our partnership and increase opportunities to work together.
Thanks, Tina. And I guess Veronica is next. And again, this is not to ask any questions. This is just for verbal comments, including what you feel about next steps.
Hi, this is Veronica Wilson with Mendocino County Social Services and COC again. One of the observations I'm making with the domestic violence partnerships is we're able to place membership with the 2 organizations or partnerships that were presented today. And that's like the COC joining to collaborate with them. But the concern that I have is that it's a one-way connection. We can join you guys and access your resources and maybe learn about, how we can apply some of that locally. But a collaboration for me goes both ways. And I'm not seeing how our COC could be engaged in that way. So I guess I'm kind of just struggling with that, and I just wanted to share that observation.
Okay. I know, Jennifer, perhaps you're unmuted. I don't know if that meant you wanted to give a quick comment to Veronica or not. Or Grace.
Yeah, I can share. And I totally see where that observation came from. So thank you for sharing that, Veronica. As I kind of mentioned a couple spaces, because I try to give a high level overview, but definitely in a lot of the spaces like regional meetings and community spaces that we have, partnership staff are always present and there and open to be in conversation. And in terms of the conference and places like that, I also touched briefly on a work group that we have that has, just for an example, that has DV agencies and county agencies, and we were looking for COCs to be involved in that. So it's definitely not too late if you want to be in a more kind of intimate setting to have that collaboration and talk about ways that your county can collaborate and ways that that could benefit across the state as well. So you're always welcome to reach out to the partnership, and we can talk about other ways of two-way collaboration for sure.
And similarly, I'll add from the sexual assault perspective that we also tried to convene our region groups or local programs. I know, for example, the LA Rape Crisis Centers have a committee that meets once a month to discuss issues that are specific to Los Angeles County. So these are always things that we are looking to help draw that through line for and ensure that there are connections at the local level and also at the state level. Similar to the partnership, VALOR does not provide direct services, but we do provide training and technical assistance. So your comment is actually something that I would like to bring back to my team and think about how we can continue to enhance those collaborations and really make sure that we're centering the needs of survivors and advancing our common goal.
Excellent. Sophia?
Yes, we
Anyone?
have Andrea Curry. Andrea, go ahead and unmute yourself.
Great, thanks. Can you guys hear me okay?
Yes, we can hear you.
Okay, great. I just wanted to thank everybody for the presentation, and also just throw a comment out there that is something that we've seen, you know, in our local area around. I know a lot of the conversation, a lot of the time is about homelessness for survivors or survivors who are homeless as a result of domestic violence or sexual assault. But I really just wanted to elevate the needs of folks who are unsheltered and their vulnerability to these situations, particularly sexual assault, situations where folks are stuck in abusive or one-sided relationships, survival sex, that kind of thing, because as a result of being unsheltered. And so I just wanted to suggest that we center that in a way that I don't really see as being focused on in our collaborations together between COCs and victim service providers, really working to support those survivors, because I know that folks in those situations often are even less likely to come forward and ask for help because of their circumstances as an unsheltered person. It can be hard to go to law enforcement and say, hey, this is happening to me, when I know that where I'm living or where I'm staying or where I'm camping is also going to be a problem, you know, if I disclose that. So I just wanted to elevate that topic for us.
Okay, Andrea. Thank you. Sophia, anybody else?
I'm checking. I don't think I see anybody else at this point.
Okay, so if anyone still wants to raise their hand to make a comment or talk about next steps, please go ahead. But at this time, while we're waiting, if somebody else does do that, what I'd like to do is ask to go back to each of our panelists and see if they have any last things that they would like to say or share. So LaToya, William, anything that you'd like to say or share at this point?
We're just happy to be in the space here. I think it's important to have the conversation. Again, in doing this, we talked at some point about maybe doing something with VSPs in the room with COCs. I feel like that's often where disconnects happen of like, hey, how exactly do I do this? What's the next step? I love having them in the space and being honest, right? If they're facing challenges and you as COCs facing challenges, some of the things Veronica shared really resonated with things that I've heard elsewhere. So just flagging it, this could be a good start to something more.
Absolutely. And just to piggyback on what William said, thank you for welcoming us into this space. We're so excited just to see the progress that not only HUD has made, because I appreciate Tanya comments earlier, but that you all are making. It's so good to just hear that folks are out there just trying to get it right, not for us, but for the folks that we serve. But one of the things that I really want to leave with you all is that no one said it's easy, right, to work with other people. The goal is really to continue to do the work, and to do it in a way which will reflect on our values of, housing first, trauma-informed care approach, and so forth. But also to realize that part of doing the work means that, it does mean taking risks and to have uncomfortable conversations. And so it may not always feel comfortable to talk about, like, what are the challenges? How can we do better? Some of the things that, have historically happened. A lot of people, whether it's staff or organizational culture, sometimes it can be challenged to kind of move past a lot of that stuff. And so I challenge you all to really try to strive to continue to push past and to really, make change happen on the ground. The reality is, most folks see HUD at the top, but the change really happens on the ground. And so although we're creating policies and, guidance and everything else, the change and the collaboration that impacts everything that we do is really based on what happens on the ground. And so kudos to you guys for who are out there doing the work day after day, to make sure that the folks who are unsheltered and unhoused, and who are challenged with homelessness, that we're constantly working to improve those situations for them, and to address homelessness in the United States and particularly California. Thank you.
Yeah, and before we move on to Dakshika and Jennifer and Grace, William, when's the COC application coming out?
Your guess is as good as mine. Hopefully on like July 4th or some great holiday. No, we'll see, but hopefully soon. I know it's working its way through the clearance process right now.
Okay. Thank you. Thank you. Dakshika,
I'll keep my comments brief so that the others have time, but I don't have much more to add. But I will say, these like any relationship, sometimes it's that first step, and that first step, sometimes you just need to take it and then see how that first step becomes a second step. So I heard some of the comments, I think Mendocino County. I would just kind of think about maybe the first step is joining the partnership and then seeing what happens next, because any relationship, things evolve. And it's only once you start talking that you kind of figure out where that commonality may lie. So I would just encourage everyone, thank you for all your work on the ground. And I know this is another thing that we are saying to do on top of everything else you're doing, but I will say again what I said, the benefits will become clear once you have like more resources and more partnerships to really help the clients we are trying to serve. And thank you, Joe and Sophia, for putting this together and for having me.
yes, thank you. Jennifer, Grace, yeah?
I'll also try to keep it brief, but I echo what others have said. I think a part two of some sort, or having another space where folks here could be in conversation with victim service providers to further the collaborative conversation would be great. I also want to say thank you to everyone who came today. I know that at one point our attendance was, over 100. And so obviously there's a lot of interest in advancing that collaboration. So I appreciate everybody's interest and time today. And I will pass it on to Grace.
Thanks, Jennifer. And echoing what everyone else has already said, thank you for the great work in this space. Thank you for showing up for your communities, for supporting individuals, their families. It is really, really powerful work that we're doing, and very, very appreciative of what you all are doing in this space.
Okay. Thank you to each of our panelists. By way of reminder, I do want to say that the PowerPoint presentation and the answers to any of the questions that were in the Q&A, that were entered into the Q&A window, they will be included in a follow-up email to everybody that was invited to be part of this. So that's the PowerPoint presentation, as well as any questions that were left unanswered in the Q&A window. We will send those out to everybody, and I'll say to our panelists, if there's anything that you would like to be added, to that email that we're going to send everybody, just send it my way, and we'll take it from there. So with that, then I do want to say that our time is up. And thank you for joining the webinar. And please continue to help advance federal, state, and continuum of care collaboration to end domestic violence and sexual assault. So everyone, be well. Be well. Thank you. Bye.